Okay, we'll give Kathy another. There's Kathy right there. Good morning, Kathy. Hi there. Good to see you. All right. So Kelly will join us if she can. John said she's traveling, so we're going to go ahead and get started. I'm going to call our executive committee meeting to order at 9:01 a.m. Good morning, everybody, and welcome. Let's see, is Marcy on here with? Yes, she is. Marcy, would you like to do roll call?
I sure will. Good morning, everyone. I will start with the committee members. Melissa.
Good morning. Executive Committee Chair, Melissa Van Hook, and Council Chair.
Great, thank you. JJ.
Morning, everyone. JJ Rico, Vice Chair for the Council and CEO for Disability Rights Arizona.
Okay, Bridget.
Good morning, everyone.
Okay, thank you, Jana.
Good morning.
Good morning, Monica.
Good morning. Excuse me. Good morning, everyone. I'm Monica Cooper, self-advocate and chair of the grant committee.
Okay, and Kathy.
Good morning, everyone. Kathy Lewandowski, chair of the Work Plan Review Committee.
Great, thank you. Okay, and then I've notated Kelly as a maybe. Staff members, we'll start with John.
Good morning, everybody. John Myers, Executive Director.
Lonnie.
Good morning, Lonnie Sates here, Fiscal Manager.
Michael.
Good morning, Michael Leva, Contracts and Grants Coordinator.
And I saw Sarah called in.
Good morning, Sarah Wood, Communications.
Okay. And is Jason on the call?
Jason has another commitment this morning.
Okay, so Jason's a no. And then Marcy Crane. Okay, that's it, Melissa.
Okay, thank you so much, Marcy. Appreciate that. All right, agenda item B, our minutes review and approval from our August 11th, 2025 Executive Committee meeting. I hope you all had a moment to review those minutes. I'm going to call for a motion to approve those minutes, but before I do, are there any comments or the corrections that need to be made? Okay, hearing none, I'm going to call for a motion to approve the minutes as written for August 11th, 2025. Do I have a motion?
So moved. This is JJ.
Thank you, JJ. Do I have a second?
Second, Kathy.
Okay, Kathy, I think I heard you first there. Thank you, Kathy. Thank you, Monica. Okay, seconded by Kathy. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, motion carries and our minutes are approved. Okay, thank you. Agenda item C, our fiscal contracts update with Lonnie.
John, did you want to present? It looks like you have the tab open, or I could present. Just let me know.
Whichever is easiest for you. I've got it just in case you didn't have it.
Well, seeing how you're already sharing, would you mind opening it?
Yeah, there we go.
Thank you.
Make it a little bigger.
Thank you. The council received a total allotment of $1,501,328 for fiscal year 2023. A no-cost extension for the period of performance was granted through September of this year. The council has fully liquidated these funds, so we've kind of met all the requirements for 2023. The council has received a total allotment of $1,500,684 for fiscal year 2024. The obligation period is through September 30th of this year, so the end of the month, and the council has fully obligated the funds. The council requested a no-cost extension for the project period, which now runs through September 30th of next year. There's approximately $121,497 remaining to be liquidated by September 30th of next year. These funds are being used for current 2025 work plan projects. And finally, the council has received a total allotment for fiscal year 2025 in the amount of $1,497,106. There's approximately $344,501 remaining to be obligated. The goal is to obligate these funds with the projects to be voted on during this meeting, so the work can be completed next year to meet the project period deadline. The obligation and project periods are through September 30th of 2026, and the final report will be due January 28th of 2028. We're not anticipating a no-cost extension for these funds, so the hope is that we could get everything fully obligated and begin and do the work starting October. Any questions on this sheet? Okay. Moving on to the council-funded projects. This sheet shows all the current projects funded by the council. Staff is reaching out to grantees to get a better idea of what they are anticipating spending and process the invoices in as timely as possible. So yeah, a lot going on. A lot dropped off in July of this year, and many of the projects that are currently listed are up for renewal, and so those will be discussed later on the agenda. And the next sheet is the budget recommendation. This sheet has been updated to reflect the projects outlined in the fiscal year 2025 and 26 work plans, as well as the funding that has already been approved in prior years. The funding year, again, is generally the year prior to the project year. So for fiscal year 2025 funds, we will be primarily working on projects in 2026. So what's highlighted in yellow are the projects to be discussed and voted on. We explored contracts that could be awarded by October 1st. So we can meet the period of performance requirement. And again, just know everything was very condensed. We've been working really hard to get things in because again, we didn't know what our award amount was going to be until May. The administrative budget has been increased to reflect the work to be done with a comprehensive review and analysis. Any questions on this sheet? Okay, that's it for me. Thank you. Oh,
Yes, sorry, Lonnie, this is JJ. Quick general question, and I didn't know if I think you may have addressed it. I know due to the kind of the delayed funding notice, that's why we're making most of the awards to the Sonoran. You said it's one question is, I think that's true if you can confirm that. And then two, is there any issue with that, or is direction from ACL or whoever you're speaking with on the federal level, I guess obviously understanding? I know typically in the year we'd have diverse grantees, a number of folks. Are there any issues or any direction, or is this kind of, I remember, I think it was John saying this is kind of our only option this last minute. So just if there's, I don't know, it's not a clear question.
yeah, no, I understand where you're coming from. Yes,
right.
You are correct. The reason why we're going with ISAs is because generally for competitive solicitations, we need at least 6 months to make that happen. And with us not knowing until May what our award was going to be, that really limited our ability. Well, actually, it didn't give us enough time to do a competitive solicitation. So yes, primarily our options were to do ISAs with universities in order to, obligate in that first year so we can meet the period of performance requirement, because they've continuously told us not to expect a no-cost extension, which would only allow more time for the work. So yeah, that's kind of where we find ourselves.
No, I appreciate that.
Sorry about that. And to your other question, ACL doesn't like to see a majority of the funding to go to the universities and the USEDs. They'd like to see it, going more towards nonprofits. But I think that they're going to have some kind of understanding based on the situation that we find ourselves in. So,
I really appreciate that. That was a clear response. I just figure I wanted just to hear it again, just to know, remind myself, but then also maybe if council members see it. I mean, it is something different than we've ever seen presented, and obviously different times. So just kind of preparing you and John and others in case that question comes from anyone else. And if it doesn't, then it was just me. So thank you. Appreciate it.
Well, and then we find ourselves in this weird position too, to where we're working on our next 5-year state plan. So it's like trying to find projects that could potentially carry over or not knowing what that's going to look like moving forward. So there's just a lot of flux, let's say, in what's going on that makes it additionally challenging.
We're there with you, so totally understand. So thank you.
Kathy?
I'm glad you brought that up, JJ. I was thinking along the same lines. I kind of wonder if we as a council have to think differently for the next few years. I don't know if it's going to change much on when we get notifications of funding. But is there a way maybe we think if we really want to contract with more nonprofits or other organizations and not just the universities, how do we get ahead of in our thinking? Because of the way the contract process is, it only allows us to quickly contract with, do ISAs. I don't know, maybe down the road we have to think about how do we do this differently to get ahead of them when they're not giving us our funding until really late, and requiring us to have something in position. So it's just something to think about, but I agree with you. Yeah.
Yeah, and excuse me, Kathy, this is John. I would absolutely agree with you. We want to be as far ahead of the game as we can be. I don't think there's any question in anyone's mind that this was an extraordinary year. And with the new administration coming into office and making some wholesale decisions about federally appropriated money and whether it was going to be available, it's not something we've seen before, and hopefully it's not something we're going to see again. But certainly with the Work Plan Review Committee, with Grants Committee and so forth, we do want to be as far ahead as we can. These circumstances were unforeseeable, I think, and were truly uncommon. So fingers crossed it's not going to happen in the future.
Yeah, I hope so, but I don't know. Yeah. Thank you.
Okay, thank you for clarifying that. Good question, JJ. All right, let's move on to agenda item D, our executive director report with John.
Okay, quick note regarding appointments and vacancies. I think I may have mentioned in a prior meeting, we have formal confirmation that J.C. Farkas has been appointed to represent the Sonoran Center. We have to have USAID representation, and we have to have representation from both USAID. We now have that, and she replaced Wendy Parent Johnson, who left about 2 years ago. So it's taken quite a while for that appointment to come through, but it's formal. And we have our Department of Education representative now appointed, Jeffrey Studer, who is the head of dispute resolution at the Department of Education. And we look forward to working with him and having him join us for future council meetings. We do have a number of other folks who are in the queue to be appointed to the council, and as of about a month ago, which was the last time I communicated with boards and commissions, those people are still in the queue, and very little has been done to move them forward. So, wish we had better news on that front, but I'll keep pressing as best I can. The story remains the same. They're overburdened and understaffed, and so things move slowly. We wanted to introduce a couple of new interns. I'm hoping they will be with us on the council meeting next week. We have 2 MSW interns from Arizona State University for this academic year, Alexander Martinez and Sharon Wool. I hope you have a chance to meet them and engage with them as the academic year goes on. We're excited to have both of them on board. They bring very different skills, but both of them are going to contribute, I think, quite mightily to the work we're doing, both in research and in policy. And so we're very pleased to have 2 new interns with us for this year. Wanted to touch on the 2026 fiscal year 26 federal budget. If you've read the news this morning, you know that there is a continuing resolution proposal in front of Congress right now. It's going to the Senate. The Democrats in the Senate are vowing to block it unless they can get some of their priorities addressed, one of which is extending the Affordable Care Act subsidy and potentially rolling back some of the Medicaid cuts that took place in HR 1. All of that is great. Nobody has any significant hopes that that's going to be passed, at least not this week. There may yet be a federal budget or federal shutdown effective October 1st. We don't know. But the good news for the fiscal year 26 budget is that all of the DD Act programs have been approved through both the Senate and House Appropriations Committees for level funding, which means that the councils will not see a cut, the P&As will not see a cut, the USEDs will not see a cut, the projects of national significance will not be a cut, and that's important to us because our Bridging Aging and Disability Networks project is one of those projects of national significance. And even as of our last council meeting in June, we were under the impression that that funding was going to be taken away. So we are optimistic that that will move forward as presented. It took a tremendous amount of advocacy to get the House and the Senate Appropriations Committees on board, and so we again are very optimistic that once a federal budget is approved, it will include that level funding, and we'll be able to move forward. And if that happens, then we are unlikely to see the kind of incident we saw this last spring where we were told funding would not be available and we had to wait until May to really get confirmation that the money was going to be there. So, you know, anything can happen, but we're hopeful. The Department of Health and Human Services, we've talked in the past about proposals to move the Administration for Community Living into the Administration for Children and Families, and to create a new Administration for Children, Families, and Community. That was held up by a lawsuit. At this point, I don't think we have confirmation that anything has been resolved. ACL still exists, ACF still exists, and we're not clear on exactly when or if a merger of the two is going to take place. What we do know is that ACF, the Administration for Children and Families, came out with a new statement of mission and values earlier this week, and we have been directed by our folks at NACDD to look very closely at that and align our language with the language that's being proposed in that CCF document. So, you know, it is out of an abundance of caution, and we all know the kinds of terminology that the administration does not favor and the kind that it does favor. So it's being recommended to us that we pay close attention to that, and I'll kind of leave it at that. Another thing, obviously we'll update you once we know what's going to happen with ACL, if anything. Another thing that we do want to take note of is the recommendation that was made by the Secretary's panel yesterday on vaccinations, and I don't think it's good news. There were some changes made to the recommendations for certain vaccines, and people at certain age levels or under certain ages. We need a little more clarity on that, but they are certainly changing the way they want to make vaccines available, and I think we're all aware that they've made changes to their recommendations related to the COVID vaccines. So, you know, we're doing our best, and I think DDD is doing its best to ensure that all of the members who are receiving state services are getting the vaccine, that they are qualified, they're eligible to receive it, and all those who want it are getting it. So, you know, hopefully we'll have a little bit better news as we move along, but we also know that the governor has issued an executive order in hopes of making the vaccine available to anyone who wants it in the state of Arizona at this point. And I had a conversation with Will Humble, who is the executive director of the Arizona Public Health Association, a couple of days ago. He said that, you know, it should move forward, but they still have to find the right people to write further documentation on it, and then they have to get the Department of Health Services to move forward with making the vaccines available. So I'm probably not making a whole lot of sense, but we're hopeful at least that those who wish to get the vaccine in the very near future will be able to do it regardless of the recommendations that came out from HHS. We'll see on that. The access and DDD rule changes or eligibility changes are probably also something you're all familiar with. There are ongoing conversations about what the impact of those changes is going to be. As you know, the rules just came out about 2 weeks ago, and they are going to dramatically affect a lot of families who rely upon services from DDD, especially and almost exclusively in the 0 to age 17 range. It has very little impact, if any, on adults who are receiving services, but the eligibility rules for people who are between birth and age 17 are going to change pretty dramatically. And we are among a lot of advocacy organizations that are addressing this. We certainly have had conversations with the governor's office. We've had conversations with Access, with DDD. Phone calls are flying around every day. We have more coming up after this meeting today, related to how we address these and how we make sure that families are getting the services they need and getting the supports they need. I will say, and I think just in the interest of transparency, there is a bit of a battle around tactics going on within the advocacy community. There are certain advocates who are pressing the governor's office and DDD very, very hard, and have in fact taken to calling their stakeholders to contact CMS about the actions that are being taken. We are not among that group. We are urging more caution. We are urging more collaboration with the state and with the state agencies. And I would say that's because we understand that the certain of these cuts were mandated by legislation. The DDD supplemental bill that came out in the spring required that there be some changes to eligibility. Federal cuts to funding of the Medicaid system have also necessitated some changes. We may not be happy with the changes that have been put in place. We may not agree that they were done the appropriate way. And I certainly would leave it to JJ to talk about how Disability Rights Arizona is moving forward on this. But the reality is that there's very, very little chance that these changes are going to be put on hold or that they're going to be amended in any way between now and October 1st when they are meant to take effect. So we need to work with the state and find the best possible way to support the people who rely upon DDD services and access services. And the last thing we want to do, and it is a very real danger, is jeopardize the renewal of Arizona's waiver with CMS or in any way cause Arizona's waiver to have to be changed from the current 1115 to a 1915, for example. That would do so much more damage than these current cuts are doing that we don't see any sense in fighting that battle. So we're trying to come to terms with the other advocates who are pushing a little harder, and we'll keep you informed. We'll certainly have more news at the council meeting next week about where those things stand. I'm happy to answer questions at any time about that issue. Again, I'm probably not making a lot of sense, but it's a critical issue and one that we're certainly at the table trying to address. The fiscal year 26 annual work plan was submitted immediately following the executive committee meeting back in August. So we don't have an approval yet. We don't expect an approval for, perhaps another couple of weeks. We certainly would like to have it before October 1st, which is when the work plan takes effect, but we haven't received that at this point. We'll let you know when it does come through. The state plan development projects for fiscal years 27 through 31 is still underway. And IHD is doing incredible work to support our development of that plan. Lots of meetings, lots of community interaction, much more to come. The comprehensive review and analysis should be ready this fall, and we will have a lengthy discussion about that at the November council meeting. We're also happy to update you at any time on how that's going if you'd like more details. And then finally, I shared with you some proposed meeting dates for federal fiscal year 2026. I think I shared those with you. I meant to. I may have failed to put those in the packet now that I think about it. Or did I?
They're not
Did you
in
all
the
get
packet.
those?
Yeah.
Oh, darn it. Okay, well, let me pull those up really fast. The only real change, we have typically for the last couple of years gone on a January, April, June, January, April, June, September council meeting schedule. And the only change we're proposing to make next year is to meet in March instead of April. And that's because of the state plan development process and allowing us to put our state plan out for public comment, have a 45-day comment period, and then allow changes or adjustments if necessary if there are substantial comments on the plan. So my apologies. I'm really sorry about not completing that.
Do you want to share those dates? Do you want to
Yeah,
just
I'm trying
pull
to.
it up and okay. You shared them with me, John.
I know.
To help John out, I'm happy that this is JJ, happy to jump in as you pull those up, John.
Sure, go ahead.
All right, so we'll start with the DDD issue. Disability Rights Arizona obviously is really concerned. I mean, we're a law firm, so we're cautiously, thoroughly researching this to make sure if there are claims that we bring the right claims. We don't want to establish bad case law either by bringing something just to bring it. And I know that there's certain folks in the community who are referring people to us by the hundreds. And just to tell you all, just again, and I'll share this with the full council, if we have 100 or 1,000 doesn't necessarily matter if there's not a legal issue there, or if someone's case is not ripe, which means if they're not currently being either impacted or affected. And so we are sending something out shortly with some advocacy tips, and then also some resources for families to start exercising their rights, so that if they are, but we have heard that families are getting notices from agencies about this going into place. It is concerning, the general concerns, I'll say, without kind of giving any true full legal analysis, is just this blanket age restriction based on cut and dry numbers where that's not, even though we heard DDD say they're going to evaluate each kiddo individually. For those of us who've had interactions with support coordinators who are charged with implementing this, the quality, thoroughness of our support coordinators, there's very extreme differences, and regardless of the amount of training, we're already hearing some anecdotal stories of how that was done, how it was communicated, and then the threats if there were non-agreements to the new numbers of hours that were going to be put into place effective October 1. So there's that, there's implementation down the road. So even if there's not currently an issue or a ripe issue to bring, I think there's going to be a lot of problems with how it's implemented, because we're charging support coordinators, we're charging agencies and others with evaluating, I guess, according to DD, something that's medically established. But to my knowledge, there's not many support coordinators that are medically trained. So there's a lot of issues. So I'll just generally say we're really looking at it. It might seem like it's slow to the outside community, but again, we do not want to establish, to John's point about calling CMS, we don't want to bring anything that's going to lead to a bad result for the entire community. So we have to be cautious, but we are looking at it, and we are working with other law firms in the state, and then also reaching out to NHELP, which is a national health policy law firm in DC, to see what their take is on this as well. Just a couple other, John, can you send that ACF document? I don't think that's made its way around the P&A yet, and so I'll put my DRAZ hat on just so if you can share that with me, because we'll have to do the same review of our websites and policies and procedures, et cetera. And then just a comment or a question for you all. Well, one of the things I didn't hear you say, John, or I don't think I heard you say, is the Senate obviously is not agreeing with the House and are throwing out their new ideas or their new proposals. Word on the street to kind of follow that line is that there's not enough votes to pass this continuing resolution, and that the Senate Democrats are actually okay with possibly a shutdown. That's what we've heard for us, at least, and this is a question, I guess, for Lonnie. We obviously do our own drawdowns of funds, so we would go to our bank account, supposedly, in the federal government, and take money down. If that's the process for you, one of the tips that we've received is to obviously draw down before a shutdown, because now more than ever, there's actually probably somebody on the other side. If this is, again, your experience, as a result of DOJ, we've had to, at least in the P&A, put justification language that is reviewed by what we think is a live person. I don't know if they're using AI or something else to screen our justification for our drawdown, but it has impacted a few of our drawdowns. And I think I've shared this before, if that DOJ person is not on the other side and they're subject to shutdown, you may not get your funds. But if that's not not an issue for you all, or the state uses their own money and then you guys pay them back, or however that works, I just want to put that word of caution that a shutdown might actually impact getting money more for agencies like ours, because it's not just a bank account where you just put a number in, it comes back to you. It's now seems like there's a live person at least screening justification language. So that might not apply, and if it doesn't, then that's great. But just want to put that out there.
Yeah, one of the things that was stressed to us on a call, an ACDD call just a couple of days ago, was that the PMS system, our drawdown system, payment system, does not shut down, even if the federal government does, because it's contracted out. So the folks who work in that area are not federal employees; they're contractors. And if I'm misspeaking, Lonnie, of course, will correct me. But we think at least in the near term, we would still have access to the money that's been appropriated for us. Now, over the long term, if a shutdown were to last for a considerable period of time, then maybe that wouldn't be the case.
Well, good. That would be good. If they're contractors, they're not federal employees subject to a federal shutdown. So great. Thank you. Thank you for sharing that.
Yeah, and just a little more context. I don't know if you want it, but no, in prior shutdowns, it hasn't been an issue for us. And I agree with you. The PMS system has created issues, especially early on when they were trying to say you can't spend the funding that was already awarded to us. And submitting reports was an issue in the system, and they did put the additional justification requirement in there. So yeah, working within the system has been tricky since earlier this year, but right now we're not anticipating a problem with being able to access the funds that have already been granted. Hopefully it doesn't become a problem, but again, like John said, they were telling us, PMS should remain open. They're contracted instead of federal employees, which was a bit of a surprise. But even with prior shutdowns, the drawdown process hasn't been a problem in the past. So here's hoping. I guess we'll see.
Yeah. All right. Thank you. Appreciate it.
Okay. And JJ, I just put a link in the chat if you're interested. The ACF document.
Thank you,
available there. All right. Any other questions that I can answer? Oh, sorry. The dates are on the screen for next year. The proposed dates, anyway. And I will say from the outset, we don't have access to everybody else's calendar. We don't have access to the event calendars for other organizations. So we don't know for a fact if any of these will conflict with things that are going on elsewhere. For example, the African American Conference, JJ, we don't know when you've scheduled it for next year. But this conforms essentially to the calendar we've been using for the last several years, with the exception, as I mentioned, of meeting in March instead of April to allow us to do the work on the CR or on the state plan development.
And I didn't note any conflicts for the major events that I attend, but I am just one person. So works for you, Jana? Okay. Okay. Well, if anybody takes a look at the calendar and comes up with something and said, hey, here's a major thing, just reach out to John and let him know, please. Okay.
Yeah, and I will make sure that this is posted with the full council meeting materials for next week.
Okay. Thank you, John.
All right.
Okay. Sure. Back to our agenda.
There we go.
Okay, thank you so much. All right. Thanks, John, for that update. We are going to move on to our agenda item E, contract grant renewals with Marcy and Mike and Lonnie, and there's so much more here. Okay.
Okay, so we have an hour, but we have a lot to get through, and I'm going to be extremely brief on the first two renewals. I just want to preface this conversation on how I'm going to conduct this. To JJ's point, 3 renewals are with the Sonoran USAID, which is going to be the first thing to discuss, and I think individual motions are necessary, Melissa, so just FYI. The first 2, I'm going to be extremely brief because when John and I and Lonnie were discussing the process for discussion of these, we do want to bring some conversation around the third proposal, which is the Sonoran USAID's better response to sexual violence, which is not completely finalized, but we do need to put it in front of the committee. And my write-up summary is rather long, and I apologize for that. It's almost 5 pages long. And I will cover that in a little bit more length, especially in some areas where there was concern about the proposal, and talk about our back and forth conversation and feedback and technical assistance throughout the contract period, and then how we kind of proceeded with the Sonoran USAID to submit a renewal application that we think would be something for the council to consider in a different format. So I do want to spend some time on that. Regarding the new proposals, one is from NAU on what we call AT Bridge. I will cover that and cover the support decision-making healthcare proposal from the Sonora NUSID, and then Michael will cover the last two related to his program. So in order to accommodate all that, I will start with which is a year 5 renewal for Native Disability Center. The proposal itself is very lengthy. I will not read that. I will not even read my summary other than to highlight some key accomplishments in their 4th year and what they plan on doing, and then answer any questions based on that as best as I can. So year 5 at $120,000, this is level funding. This program will not carry over into the new state plan. This was to address the targeted disparity requirement that the federal government required all councils to consider. And what I want to do is just say they had, in terms of year 4, the objectives did not change throughout the 4-year period. They are making 2 changes, minor changes going forward, and 2 out of the 4, and I'll cover that in a few minutes. The purpose of this was really for the Sonora NUSID to provide tribal education information to Arizona's 22 tribes. They have done a lot of work and even outreach to other tribal nations around the country through a lot of their workshops and online presentations and so forth. But primarily they are to address the Arizona 22 tribal nations and off reservation urban communities that surround the larger, Phoenix area and Tucson and so forth. And it really was to engage and utilize the expertise of partners to assist in tribal education on workforce programs, what parents and guardians need in education, healthcare area, transition area, special education, and I think they have done a really tremendous job. The first objective was to expound outreach and engage with the 16 tribal education and health departments and 3 tribal colleges to identify disability and workforce needs. I went ahead and typed up at least 4 different accomplishments, but I will highlight the first one. They met with 16 tribal education and health department and voc rehab programs to identify and have quarterly meetings with 4 VR programs. So they met with Navajo Nation Office of Special Education and Rehab Services, Hopi Tribal VR, and the WEO programs, the Tohono O'odham Nation Tribal VR and their WEO program, and then Child Development and Educational Support Services with Gila River Indian Community. So those meetings will continue and have been ongoing, and you'll see some other write-ups related to that. Objective 2 was to strengthen Native youth and adult workforce resources and opportunities in 3 tribal communities. This was the targeted disparity specifically focused that they did. And I do want to highlight 2 things that they related to this. So CIE is what they call the Circle of Indigenous Empowerment Program. That's their larger umbrella of where this grant falls under. So if you see CIE, that's what that is. CIE convened quarterly meetings of state and tribal VR programs, tribal employment programs, state employment programs to discuss streamlining of the application process for those that are eligible, cross-eligibility of programs, and brought awareness of challenges and successes. And then the last point was the CIE provided technical assistance to build capacity for transition services, leading to meaningful employment opportunities in 3 tribal communities, Navajo Nation, Tohono O'odham, and Hopi. The targeted disparity is a specific focus on the Navajo Nation. So we do receive an update on that, as well as their performance measures at the end of the narrative period to report back on this particular area. The third objective is to the CIA to expand monthly training and continuing education opportunities for key stakeholders to increase their awareness of disabilities in Arizona tribal communities. 3 highlights. The first bullet point between October, when this contract began, through June is CIA hosted 6 webinars. I don't have the topics offhand with me, reaching 279 participants on various topics. Many of this also includes, like I said, other tribal nations that attend these webinars. So Agnes Ataki, who's the lead program staff person, along with her key staff, do a tremendous outreach to other tribal nations, and they're learning from what Arizona has done and how they can replicate in their own tribal nations within their states. CIA hosted 1 focus group with Arizona Department of Health Services with 8 parents as part of the discussion with ADHS children and youth with special healthcare needs. It's a Native American focus group for the Title V Maternal Child Healthcare Block Grant. And then the last bullet point to highlight is CIE, also developed numerous outreach resources. They drafted 5 sheets on disabilities to cover hearing loss, vision loss, autism, assistive devices, and advocating for your student. So those went out as well for additional resources for parents. The 4th objective that they address is to collaborate with state and national federal agencies and tribal programs to increase awareness on disability service for Arizona tribal nations. To highlight one of the areas that was successful was they partnered, and their partners include Native American Disability Law Center, which I think we're all familiar, is up on the Four Corners area. So it's Colorado, Utah, New Mexico, and Arizona. And we do collaborate with them as well. NAU, the National Congress of American Indian Disability Policy Work Group, the Consortia of Administrators for Native American Rehab. The meetings are important to promote a comprehensive network of services that address the diverse needs of Native individuals with disabilities and address new partnerships or solutions to barriers. And then one thing I do want to highlight is they were meeting in the past with federal agencies out of the Department of Labor, but because of the changes under the administration, all of those meetings were canceled due to changes by federal directives. But doesn't stop them. They're still going to find a way to meet at least with the other consortiums. For year 5, as stated, these 4 objectives remain, but they've updated the first one and the 4th one. And then in the proposal, they have a lot more information showing specific activities per quarter and the staff that's responsible to carry them out. So I do want to just highlight the first objective and the 4th objective and what's been updated. So again, the first is to expand outreach and to engage with tribal colleges and universities and school districts. In year 5, they will expand to include 3 additional universities and 4 school districts. And then the 4th objective, which has been updated, which is the one that's focused on the collaboration with state and tribal and nonprofit organizations. They plan on including information or how to support recreation and social connections towards overall holistic health and well-being, which is a topic that has come up during their meetings with other folks. So objective 2 continues. In year 5, they will focus on creating school-based independent learning centers, work-based learning experience, apprenticeships, and leadership opportunities. And maybe something for Michael's committee and his work, since they are focused on workforce resources and opportunities, to make sure that his committee is aware of what's going on with the Sonoran Usage Grant. And then the 3rd objective is the same, but in year 5, they will expand efforts to create training sessions for parents and teachers. So in the last year, how they do this, a lot of work is newsletters, monthly webinars, and educational trainings for teachers, parents, and guardians on IEP. There's transition planning information. There is information on accommodations and advocacy, and then quarterly 1 community training or workshop on topics that is identified from partner meetings for parents of Native youth with disabilities, educators, or healthcare advocates, and they will continue that. And since this will not continue over in terms of continuing another year grant, I think as the council develops a state plan, something to consider obviously is our partnerships with the tribal communities and how we can continue to support them. Any questions?
So, sounds like they're doing a great job. I was looking at the brochures they're creating, and I was wondering, do we have any intention as a council of posting those on our website for, families, Native American families?
They're on their website. I think what we have to, so here's the thing that's been going on with U of A. They are hopefully soon to hire a new communications director. The previous one that Sarah had worked with in the past left, and they were under a hiring freeze, and then I think that got lifted. And now they've done interviews. I think they've made a selection of someone they want to bring on, and we want to ensure that whatever they they have created with our council funding, we have access to and be able to share resources. And I think that is something that as soon as we know that they have someone on board, it's our intent, and I know John has the same intent to ensure that Sarah builds a collaboration partnership with that person and shares resources so that we can find, even if it's a way that we could share it on our newsletter or make people informed that this is important for people to access. They could go to the Sonoran Usage website.
Yeah, because I was, well, it's a roundabout way of going. It feels like as a council, we should be have it on our website to share. Families would come here before they'd go to the you know, to the colleges or universities, look for information. At least I think they would.
Yeah, I think it's something we need to talk about and figure out how we do that. There's always a conversation about our website, how to make it more engaging and the updates that are constantly needed. So I'll leave that to Sarah to address. But yes, I totally understand.
So I don't want to take any more of your time because I know you got.
No, that's okay. I appreciate it. No worries on that, Kathy. Thank you.
Okay.
I apologize. My phone went off and I can't access it right now. if you hear a ring. Okay. Any other thoughts or questions?
Kathy, this is Sarah. I can follow up with you.
Thank you. Melissa, back to you.
Oh, okay, JJ.
Sorry, I didn't get my
Oh, I'm sorry.
hand raised in time. Again, looking at what John just sent over to me, is there any concern, none by me, but just any concern that funding a project focused on the Native American community would run afoul of ACF's recent guidance? Just felt I should ask. Personally, I would support this regardless, but John, do you have any intel?
Yeah, we are getting sort of conflicting signals because we know that HHS has been doing a lot of outreach to Native American communities and seems to, I mean, for example, when the secretary was in Arizona a couple of months ago, he went up to the Four Corners area and specifically had meetings with leaders of Navajo and Hopi tribes. So we know that there is some kind of exceptional outreach taking place with Native Americans. We also know that, you know, everybody wants to shy away from using diversity, equity, and inclusion and so forth. But we also have to act in accordance with what the DD Act language says, and that specifically calls for us to do work around diversity, equity, and inclusion. So it's all kind of confusing. I don't think there's a whole lot of clarity in my opinion, and I would, I guess, look to the council for guidance on this. In my opinion, we have to continue working in this area. It is too important a population in Arizona for us to abandon it. And it is, there's been too much good work done for us simply to step back from it. So I don't have any great concerns about using the language we're using or doing the specific outreach to Native American communities around the state, given, I guess, given what's been happening during this administration.
Thank you. No, I support the project. I just wanted to ask, just to document that we're having the discussion. So thank you.
Kathy, go ahead.
And I support us continuing on. I think it's very important. Let's walk the talk. But I've also, with my experience in reviewing other states' reports and applications, they have gone to taking out the words inclusion and equity, but they still serve the communities, like Native American communities, and they list them, you know. So I think that's the way we proceed. We may have to stop using the words equity and inclusion, but we still need to list the communities we work with. And yeah, I think it's important.
I appreciate that, Kathy. That's a good way of moving forward.
And I second that, Kathy, and everything else said, but that might be a way to keep things moving without any problems. Okay. Are there any other comments or questions? Okay, hearing none, I am going to call for a motion to approve the Native Center for Disabilities Circle of Indigenous Empowerment Year 5 from the University of Arizona Sonoran Center in the amount of $120,000. Do I have a motion?
This is Vijette, so moved.
Thank you, Vijette. Do I have a second?
I'll second.
Thank you, Monica. All those in favor of approval, please say aye.
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 All those opposed, please say nay. Is anybody not voting? Okay, motion carries. Approved.
Okay, thank you. Okay, crisis response and trauma-informed care is the second renewal proposal from the Sonora News Said. Again, I will just highlight their year one work that they did. And if I say TIC, I mean trauma-informed care. It just gets a little tiring typing it out and saying it. This particular project was in our work plan for, I think, the first 3 years. And it was something that Erica had put in without a lot of details on what she wanted to address or how or who was going to be the focus. And it, with JC's support and with the report that was done back in 2022 on Arizona's crisis response and people who have ID and DD, there were findings, and we wanted to ensure that she used that report as the basis for how she and her team kind of thought about what they were going to do. They only created 2 focus areas, and those will continue. But I think the first thing in understanding about, even though the report had information from the Sonora News Sed's perspective, in the first area, they had to do under creating some sort of TIC curricular development. It was important to understand what is already out there. And so obviously what they do very well is they do a literature review on identifying existing resources, reviewing the literature on the topics of crisis response and TIC for the IDD community, and then a needs assessment survey to identify community interest as it relates to trauma-informed practices and training needs. And they had 54 responses that they received. They also did a couple of interviews with key stakeholders from Diversibility, DDD, and ACSTV to figure out how they would move forward on this. And then bringing in the Native American perspective. Agnes Ataki was instrumental in helping to develop a working document related for the disability community for Native Americans. And just a special emphasis I put on here, which was important, is that TIC for American Indian communities has to be culturally sensitive and to address the impacts of historical and intergenerational trauma that's rooted in colonization, but also recognizing their resilience. And so she was helping to draft some information to as part of the Sonora News Said team. She was instrumental in doing that. The fifth point, the Sonora Center collaborated with U of A Western Regional Public Health Training Center, and they developed a self-paced online module around this first area, the focus area. The second area they wanted to do was, obviously, after they have this information, is now how do you create information and do outreach and dissemination? So there was a number of things that they did. Obviously, Lynn Tomasa is very instrumental in having a lot of background information in this. She was a guest lecturer at U of A with the Sonoran Center's Disability Perspective, which are classes for bachelor's in medicine students and other health and allied professionals. So she was a guest lecturer that incorporated TIC for the disability community into those courseworks. And then JC Farkas presented adverse child experiences, or as we know it as ACEs, and complex trauma in relation to disability for 2 classes led by the same Sonoran Centers for Disability Perspective. And it's also for a certificate in DD program community portfolio courses. I think you'll see this throughout. What U of A does is they infuse their topics into the coursework upcoming, and it's really to bring those students to begin to think about the disability perspective and how, whether it's healthcare, whether it's trauma-informed care, behavioral health issues, sexual violence, they start bringing that information down to the coursework for these upcoming students that are going to be graduates and work in the professional field to begin to have a disability perspective, which I think is really important. And I appreciate that they are thinking about that as a way for outreach and dissemination, as well as other universities could take this on as well around the country. The third bullet point was assistance from student trainee interns. They developed a working list identifying other U of A courses so they could be included as well as into the College of Nursing. Barbara Brent is also part of this project. She is working with Self Advocates to develop community resources for people with disabilities and their families. And you'll see in year 2, they plan to do a lot more, where they identified, well, she's going to be working closely with David Taylor, Teresa Moore, and John Britton, and Lynn Black with Ability 360 to do further work on this area for Self Advocates. And then lastly, they partnered with Disability Rights Arizona at the African American Conference on Disabilities, thank you, JJ, for a mental health care track that included 4 different sessions. 2 of the sessions were conducted by the Sonoran Center staff, and then the other 2 sessions were done by other professionals. So they're on track to complete the rest of the work by the end of this month. And like I said, I think they've done a really good job in taking something that was so vague to kind of present something in a very comprehensive manner. So going forward in year 2, they're going to build upon this work, propose new activities. And then I just highlighted again, the first area is to expand the TIC curricula for current and future professionals. So they've listed how they plan to do that. They're going to develop and pilot 2 4-hour curricula for disability professionals and healthcare providers. They're going to pilot modules based on the foundational curriculars for future professionals in healthcare in other institutions of higher education. They have already identified additional courses taught by U of A with faculty to incorporate that. And then Dr. Tomasa will work with U of A Forensic Nursing Program to develop a module on how to support individuals with IDD for inclusion in their curriculum. And they will research the feasibility of offering a weeks-long online course for students in the community on trauma-informed care. The second area is behavioral health and crisis support education awareness for people with disabilities and for families. This is going to be led primarily by Barbara Brent, like I said, with 3 Self Advocates and Ability 360. They plan to develop, pilot, and implement workshops and accompanying training and presentations materials by Self Advocates for Self Advocates who have lived experiences on this topic, which is really important. And they plan to develop a care guide, which is an advocacy checklist for people with IDD on what to look for and what they need in order to navigate and receive behavioral health care services. All this information will be reviewed and approved by Self Advocates and then shared through different workshops. And then the outreach and dissemination part, which is with multiple partners, they plan on developing shorter and more focused stories, almost like a StoryCorps type creation of videos or either potential podcast that brings the voices of those through the lived experiences, which is important for others to hear and to know what they've done and how they went through the process and received services. They will have a lived experience inventory, which is very creative, to create case examples that can be used for courses, webinars, or upcoming presentations. They are having a meeting coming up in October with Pima County Justice Services Advanced Crisis Response and Intervention Training. And they are, again, with JJ Rico's Disability Rights Arizona and the ARC of Arizona. They plan to offer a workshop for professionals on legal options for crisis support, helping professionals understand the recent changes in law and how to share this information with families. They have a robust evaluation process that they do with all their contracts. Obviously, they will do feedback from workshops, participants and self-advocates, feedback on all key areas that focus in addition to developing surveys on their curriculum at the schools, during their coursework. And then we asked JC to consider as well a 3-month post survey for those that have gone through training to capture how participants plan to use the information they learn, provide examples if they have used this information, how it impacted them. And then the last one I put was a thought about sustainability. One of the things that was really important in my conversation with JC, that what they developed can be shared beyond U of A into other universities and with other partnerships that they have established, beyond Arizona and Pima County, obviously. Questions on this particular program?
Okay. Hearing none, I'm going to call for a motion to approve the Crisis Response and Trauma-Informed Care Year 2, University of Arizona Sonoran Center in the amount of $100,000. Do I have a motion?
I make a motion, Kathy. This is Kathy.
Thank you, Kathy. Do I have a second?
I'll second. This is Jana.
Thank you, Jana. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone not voting?
This is JJ. I'll abstain because we're mentioned in the proposal.
Okay, Jason is abstaining, but with that, the motion passes. Thank you. Approved.
Okay, I'm just making a note, JJ.
Alrighty.
All right, let me pull up the document because I don't have a printed one. So give me a second here. There we go. Okay, the next one is the Sexual Violence Collaboration Project. We tried to finalize it for you guys and we were running into, we got to get this out. So appreciate John sending out my summary, and probably he edited a bit, but it was rather long, and apologize for that. But I think it was really important to kind of lay out some areas that this project was, in the sense, really important, because this was through a competitive solicitation. So just FYI, the Sonoran, through an outside committee evaluation, had, I think, 3 or 4 proposals, and I believe it was 3. And then the Sonoran you said was the proposal that was picked by them and then approved by the council last year. What the scope of work had was the first 4 objectives. The 5th objective is where, again, as I stated, collaborate with academic programs in colleges and universities that train future behavioral health, public health policy, and direct services. That is something U of A added that was approved. But the first were part of the scope of work, where they had to establish a collaborative committee to develop a strategic plan to coordinate a sexual awareness campaign. It had been, so I'm just jumping into just right into this contract. The outcome was mixed. Throughout the contract period, they had expressed that they were, through our narrative reporting that they submitted and my communication with them, seeing that they could not form a robust committee. The application had a list of names and agencies, these folks that they were going to collaborate with. No doubt that they made numerous attempts to try to pull a big group of folks together to be the advisory board to oversee the next tasks that were very important that were laid out. But through different approaches and barriers that they encountered, they just could not do that. And it really was evident that they were not going to be able to meet entirely this way. So what they pivoted, what Lynn Tomasa, who was the lead on this, pivoted, was she started having individual meetings and conversations with key folks and have it be a little bit more focused. And so that's the way that they address this. So you'll see in the proposal, if you read my outline, I put it was mixed. They were to have it, but then they just couldn't. And so they really met with these folks to seek input and content on areas to focus and to develop resources. So they do have a core group of folks. The ARC of Arizona participates, ACES-TV, and you'll see how robust they will be in year 2. Arizona Sexual Violence and Disability Network, DRAS, Encircle Families, Jana, thank you very much, Ability 360, and SWI. So it's not that they're not meeting with folks or they don't have a core group, but it became difficult, as we know, to hold meetings on a regular basis that is consistent with a larger group. Through their interactions, the sexual awareness campaign led to a new project name, which they stated in their proposal, and to broaden the focus not only on sexual violence risk reduction prevention, but to integrate messaging on sex education and healthy relationships. And you'll see that and how they're proposing that with a project that they're partnering with Special Olympics. Collaborators are working on developing accessible plain language resources on 10 topics, which is really important. If you look at their proposal on page 2, they list out the 10 topics that could be used by the community. Coming up next week, they invited staff to their upcoming in-person working session with partners and self-advocates at the Desert Willow. ADDP staff, 2 of our staff, and then an intern will be attending that. I will not be attending, but other staff will. And so we hope to gain an understanding on how well this meeting went and, actionable steps going forward. So I'll be interested to hear about that. Their second requirement was for review the existing resources that was developed by the previous grantee that had this contract, the Disability Network, the Arizona Sexual Violence and Disability Network. They had developed a number of resources for the first 2 years. And what we wanted U of A to do, the Sonoran Center, was to review all this existing resources, go through it and with your partner, especially with ACES-TV, determine how good the resources are, update them, create an inventory, and figure out ways how could be adapted for specific audiences and what information is missing. So no concerns around this area. They have done that. They have their student interns also participating to gather the existing community resources. They created an inventory of information on these. They're going to finalize how to present and maintain the resources across websites. So Kathy, to your point, how do we share this information on our website is going to be really important to do. So we'll make sure that is incorporated going forward. The third area, which was a difficult area for them to kind of tackle, was at a systems level. They had to identify at least 2 policies that had to be developed, either new and or enhanced, to support individuals with IDD who had been victims of sexual violence. In their proposal, they stated they wanted to focus on mandatory and optional training for DDD vendors and staff, support coordinators and IOC committee members, community organizations. They're going to keep that as a focus. The second policy they wanted to address was with access and DDD, the incident flowchart assessment. That was part of their application. And then after meeting with DDD, I think of several times, it was just not feasible to proceed with this particular policy. I'll leave this to John to address further in just a couple minutes. So what they did instead was they shifted their approach to focus on understanding 2 other policies that will directly impact victims, survivors, and families regarding sexual violence. What occurs after a report is made, after the different systems to support the victim and their families. So if there is an allegation of sexual assault, neglect, or abuse, who makes the report and what happens afterwards? So what is that process and who are the different systems that are engaged? So they wanted to pivot to focus on that. And then obviously mandatory and optional training for DDD vendors and staff, support coordinators, and others in the system. Is it adequate to address this issue? They still wanted to be that a key focus. Their project team held meetings and interviews with other key DDD and access personnel, as well as ACES-TV, to address this area. They have a doctoral student policy intern that is also assisting with policy analysis, and they plan to analyze and summarize their interviews on investigative processes and follow-up after a report for mapping and identification of gaps and potential improvements. They plan on creating a list of mandatory and optional training. So this is some of the work going into their second year that I highlighted here. So this was a difficult area for them to address, understanding that, obviously having agency support and agency buy-in is really important. It takes time. There's also the issue of whether agencies could take on anything more and new without funding or without legislative mandates. So we'll get into some of the discussion around that area. The fourth key scope of work area that was important for them to address, again, this was kind of difficult for them, was to engage with policymakers and elected officials to propose new policy changes that would strengthen existing laws for the prevention of abuse and neglect, proper reporting and investigating allegations of sexual violence toward individuals with IDD. They adjusted this work to focus on, again, they wanted to keep mandatory reporting and sex education as 2 areas identified by the advisory members during their meetings, and feedback to provide the project team. Meetings with Arizona legislators or proposed legislation was not a focus. Obviously, there are 2 issues. It's the Sonoran use of their university, and 2, we don't allow per our grant outright lobbying work around this, but there are ways to do education. There are ways to present, starting this focus to present education to legislators on why this is important to do. So, what they plan on doing instead is with their policy intern, They're going to look at what's in place under Arizona statutes and policies to compare them to several other states. I believe just 5 other states. I'm not going to do in that 50 states review, but at least key other 5 states. They have also consulted with local and national leaders who have experience with these policies to identify barriers and successes. And then the last thing that they added was obviously how to move this forward in the colleges and universities to train future folks, which they've done a really good job on doing. So I'm not going to read too much in here. They have Dr. Tomasa and key folks that are working on this. They are also planning to still move this forward with the sexual assault nurse examiner SANE training program at U of A's College Nursing. And then the sex education thing, which is really important to just highlight, they're going to collaborate with Special Olympics of Arizona to support the delivery of their training titled Understanding Me, the Athlete's Guide to Navigating Healthy Relationships. It's meant for its participants who are 18 years of age or older with or without an IDD, but we need more information around this area, obviously in some other key areas. So in year 2, they're going to move forward with this with this program, but with the change that I want to spend the next discussion around, it's just around the advocacy and the policy change. We had a phone call conversation with JC when we got the first renewal draft application that we basically said, no, we're not going to move this forward. We have to make a lot of changes because they need to strengthen how to bring the policy aspect to this more robust, and for ACES-DB, if it was possible for the ACES-DB to be more of a partner. We also had John had separate conversations with the executive director of ACES-DB to see if they would even be willing to have more of a significant role, and they would have conversations with JC on how that would look like. So what came back was wasn't too much changes on the first focus, which was obviously the information and the resources and development. Expanding outreach to higher ed and the curricular courses. But I do want to talk about focus 2, advocacy and policy change, which is on page 4. And this is where you'll see in the budget, there's about a little under $12,000 that will be allocated to ACES-DB, where they will have this key, they would be the primary key folks who would carry this on. So ACES-DB will draft legislation. So the first thing is under that paragraph is they plan to draft legislation by the end of this year, which is crazy, with stakeholders from IDD community to address Arizona's mandatory reporting statute for vulnerable adults. The legislation reform is meant to better reflect the needs and realities of individuals with IDD who experience sexual assault. The current law is unclear and not specific as it relates to mandatory reporting requirements. They plan on drafting a bill. They plan on seeking sponsorship and hopefully have it introduced in the upcoming legislative session. They will leverage their knowledge on how to develop and do this because they are really involved in the legislative process more than the Sonora and you said. So that's why it was a kind of a good fit that they would be willing to do this and lend their voice during testimony at legislative committee. In addition, self-advocates and survivors will be included in calls to action to influence this process. One area that we want to make sure we're very clear is not to violate our the area of concern that I always bring up is no lobbying about a bill, but how do we begin the process to educate and who are the advocates and stakeholders who can go in and advocate and push for legislative change. So they're going to be key in doing some bringing other folks on board to help do some of this legwork. The second area that ACES-DB will do is create an advocate packet designed to equip parents and community members with the tools needed to engage local school boards on the issue of comprehensive sex education. We know that this is not going to be an issue done through the legislative way because they don't want to deal with this. This is not, and everything is local on a school district level about what's taught. So together with the Sonoran Center, they plan on hosting 2 education sessions reaching approximately 50 participants on the use of this packet for parents and community members. And we still have a lot of questions around this because I don't see how this ties back to school district making changes to allow sex education to be taught in the schools in the manner that it needs to be taught, especially for individual students with IDD. So we still had a lot of questions around this, but this is what they proposed. The third thing that ACES-DB is proposing with the Sonoran Center is, this is Lynn Tomas's work, I believe, is a systems mapping and systems reform of DES investigations. The systems mapping is the processes individuals experience during a DES investigation related to sexual assault and abuse of people with IDD. ACES-DB will identify potential short and long-term policy and procedural reforms to improve the investigative process, reduce re-traumatization, excuse me, I can't say that word, and increase accountability. The last thing that they plan to assist the Sonoran Center is to introduce them with other stakeholders that perhaps they are not familiar with or don't have close ties with, and that includes partners in the sexual assault prevention world, victim services. It's very important that there's connections with law enforcement, education, and other healthcare folks that work with survivors of sexual assault and abuse. Again, focus 3 is around education and their partners. So just wanted to focus on that key part where ACES-DB is really going to have more of a significant role. I will toss this to John if he wants to make any comments, and then back to Melissa.
Yeah, thanks, Marcy. That was that was a great overview of first of all the project, but also some of the challenges that we've been seeing with the project. I could go on at length, and I will try not to. I will say that in a nutshell, we are not satisfied with the proposal, the renewal that was provided to us for a number of different reasons, most of which Marcy covered. It was our intention when this original solicitation went out for the primary objective to be policy focused. We knew that it wanted to build on what Lynn Tomasa had done in a previous grant from us and the report that she put together on lived experience. We then wanted that to translate into some policy action. And we anticipated during the first year of the project that would come about. Granted, we had some reservations because the Sonoran Youth did not have a lot of policy experience, but there was a feeling that with Lynn's report as the basis, it could really build on that and some work could be done. That did not come about. And we expected when the renewal application came in that the public policy aspect would be a much larger portion of the project. And maybe speaking just for myself here, but it was certainly my expectation that a policy that actually makes a difference for individuals with disabilities was going to be a real key to what was being proposed. Again, in the proposal that we have in front of us, we as staff are not satisfied that that's what's going to happen. There are a lot of challenges still to be met. There's a lot of vagueness to some of what's being proposed. And we want this work to continue. We know how important it is. The council has been supporting this work since 2018. We want the situation, the circumstances for the IDD community to improve. We're trying to see, or again, I guess maybe I am trying to see how this proposal actually does that. In the end, when I read this, I was left with the question, how does this make a difference? How does this actually improve conditions? The steps that are outlined, the tactics in this proposal are all good. It's just a question of, are they good enough? Do they go far enough? And will they actually produce outcomes that improve circumstances as opposed to simply take additional steps toward outcomes? So that's kind of my situation. Now, we're in a situation here, as we talked about earlier today, where we have to spend a certain amount of money or we have to give it back to the federal government. So I want to be clear about that. We don't want to just throw money at a project because we don't want to send it back to DC, but we also want to make sure that if we're going to spend money on the project, it's achieving the goals that we think are important to the community we serve. So we're torn. I hope I haven't just confused the issues that Marcy laid out, but we're a little bit torn about how we proceed with this. We think that with the proper modifications, it could be recrafted so that it's achieving what we wanted to achieve. It's just that it's not there yet, at least in our opinion. Marcy, am I off base?
No, I mean, we talked at length by staff. I think even on Tuesday, like in 3 or 4 o'clock, we were having conversations about what to do. We have had numerous conversations with Lynn throughout the grant period when we started seeing things, being concerning to us. Obviously they give narrative reports to us on a quarterly basis, and I was not seeing, I was seeing concerns around these areas. And brought that up to John, and we immediately started having meetings with Lynn primarily to try to figure out what's going on. And we got to a point probably before the renewal notice went out to bring JC into this conversation, because she was not tied into this grant, and she was a little bit hesitant in the beginning to have some conversations with us, but then she realized that she needed to have some serious conversation with us about what they plan on doing and how to address, and to really listen to our concerns and to think about some of our suggestions. So our suggestions was, how can you strengthen these areas, especially around the policy work? You know, we're not going to change the scope of work. I'm really not allowed to change the scope of work per se, but you have to continue to work on this area, which is the policy. And that's when, you know, it was thought about, you know, who is strong in that area. She's already working with ACSTV, but how to bring them on board in a different capacity that they take the lead on it because they have more experience. And she was open to that. And so was ACSTV. And I think when we got the updated renewal proposal to see that, what brought another concern was the amount of funding difference became another thing that we were thinking about. Why so much going towards the university versus ACSTV, who should be doing a good bulk of this work? But JC did say that is what the amount they came with. It wasn't what JC suggested. It's what ACSTV came back with. They said they could do this work for this amount of money, and that's what they accepted. So we went with that, and knowing that we still have some outlying concerns and questions on some key areas that they want to do and how it's going to be implemented and what's going to be the impact and so forth, we still need to get that information. But because we're running out of time and with the concern with the money, we felt it was better to bring this to you guys to have some conversation and direct us further.
Well, it puts us in a really kind of a bad position, right? Because I have read through, you know, what you guys have shared with me too. And you know, my first instinct was to not approve this for renewal. But I'm really stuck on giving money back to the feds. What kind of position does that put us in? And more importantly, are they going to be able to carry out what has been specified for year 2? Is that going to happen? Are we throwing good money after bad, or bad money after good, or whatever that expression is? I don't know. JJ, did you have a comment? Because your mic is off. You have input?
Yeah, quickly. I mean, I was hearing everybody. I really appreciate the thorough presentation and the real clarity on where the council is. And so I was not prepared to support it, but if it means we're reverting funds back, what is the solution there? But I also don't think we should just put money out there in a project that may not achieve the goals, because then you're in the same, sure, you spent the money, but then you're reporting work in progress or unfulfilled or unmet. And again, I don't know how you would phrase that. You all put together the annual report, but we've been routinely commended on our quality of our reports, quality of the grant, and the results that come out from them. So I want to continue that. And I think even if we're reverting back, what's the request here, 72,000, it's not a large enough amount that I would be concerned about at the expense of not a project that may not fulfill what we were hoping it would fulfill. So I'm still prepared to not support this going forward unless both John, Marcy, and others on the council staff feel it's a really bad look to not spend all the money, even if it's only 72,000. So I would like to hear about that. If it's, you know, what your position is on the reverting of funds back versus the project that may not fulfill its stated goals.
And I'm in the same spot, JJ, so I'm ready. Go ahead, John.
My feeling is that we want to do everything possible, clearly, to avoid returning money, especially at a time when, as a council network, we're all asking for more money to support our programs. I don't think it's a good look for us to be sending money back. I also don't want to spend money on a project that isn't going to achieve the outcomes we want. My, I guess my only recommendation, or my thought anyway, and I would ask Lonnie and Marcy to weigh in on this, maybe Mike as well. You all have been working on grants and contracts for a lot longer than I have with the council. My thought is, and maybe propose to all of you that we seek some additional clarifications. We seek maybe some modifications to this renewal proposal, and that we perhaps approve it contingent upon the changes being made, and maybe they won't be made by October 1st, but approve it contingent upon changes being made that satisfy us that it's going to achieve, or more likely to achieve, what we want it to. I don't even know if that's a possibility, but that's the only way that I can see moving forward. I don't feel we can approve it as it's presented right now, but I have some level of confidence that we can recraft it, or work with Sonora Center to recraft it in a way that is more satisfactory. But I don't think we can do it by next week, though. That's the problem. We would have to ask the council to give its contingent approval. You're muted, Melissa.
I couldn't tell if I was just frozen. Our other staff, Lonnie, Marcy, Mike, Sarah, you guys have anything else to say on that?
Yeah, I'll jump in because I've been here the longest and oversee all these contracts. To John's point, we do not have enough time to seek another clarification before the council meeting next Friday. I would not want to do that to JC, because I don't think it's fair to kind of get something in place, something back to us in another, 4 to 8 hour period. I think we need to sit down with whoever wants to sit down with us from the executive committee, perhaps, if you want to join in identifying key things that need to be strengthened. Because we keep coming back to the same conversation. I know we're running towards 10:30, and I am so sorry. We haven't even gotten through the rest of the proposals. So that's Melissa, I'll get that back to you in a second. But I think having other people send us your comments and concerns will help us have a larger and a bigger conversation with JC. And so if you don't approve it, that goes as a motion, but with the request that we go back and have a revised proposal based on the additional feedback. And so we need additional feedback from you on what, maybe some other areas that you want us to take back to JC. More than happy to do that. The question that JJ asked about, how do we feel about reverting funds? I personally don't have a problem. I know I hear John, this is not the time to do it. Councils are always asking for more money. I come from a different perspective, where I worked on contracts in the governor's office for 10 years. We routinely reverted funds back in the governor's office all the time with a lot of different programs. So we were very cautious about that. And if there was and to the point that we are always really comprehensive in our PPR reports, because the grants really provide really good information, and we have good programs that go out. Yeah, we also report on the barriers with our grants too, just to make it clear. It's not all cake and ice cream and confetti, but sometimes we do report on some of the struggles or ways that we're tackling them. And this would be no different, in this PPR that we will do that will cover this year one activity. But we would like the guidance from you guys on if you do a motion for a no vote, but under consideration that we will look at it at another time to consider with additional input from them. I would be glad to do that. It's not my call about reverting funds back. Obviously, I know how John feels, and I know how other folks may feel, but that was just my personal.
Okay. Kathy, you've had your hand raised for a bit. Thank you, Marcy, and thank you, John.
I guess for me the question is, do we think all the work they did in year one is good? And do we want to just stop a contract in year two? And what happens to all the year one work? I mean, was it the stepping stone to really getting to something better in year one? And now we say, no, we're not going to do a year two contract. Do we say, okay, we'll take this year to talk to Sonora and you said for next year and then continue on what we did in year one. What are our thoughts there? I did hear one thing when you were talking that I don't see any performance measures or for outcomes. What are we trying to move the needle on? And have we ever thought to ourselves, what is it that we want to increase the number of individuals that understand, sexual violence and how to train on it? What is our outcomes that we really want to achieve? And is this contract, has it moved the needle enough to get us to what we ultimately want? So this is all going around my head. So I just need to know what happens with year one work.
That's a good
Well,
question.
I will try to tackle at least part of that. From my personal standpoint, the work achieved in year one was not adequate. It was not in conformity with the scope of work. It was not according to the goals that were laid out in the original proposal. It was not up to expectations. And in particular, from my perspective, the policy aspect, but even the other components did not achieve what they needed to achieve to conform with the original contract. Marcy laid out some of the areas where they felt they were challenged in getting their committee together and getting work products produced. So, we were hopeful that the renewal would include work that would move them farther along. Personally, I don't have the sense that it does enough in this proposal to get them where we want to get the work done that we want to see done. Does that mean that we just want to throw the baby out with the bathwater? I'm not to that point yet, again, because I think the council has supported sexual violence work for a long enough period of time that we don't want to just see it disappear. We want something actually to be achieved. It's just not likely to happen with what we have in front of us.
Okay.
So I don't know if that answers your question or not. I would really hate to see us completely step back from this work at this point, but we don't want to be spending money on something that doesn't achieve something.
So my other question is, do you have time to look at your other contracts in place and provide more money to them to do something else? So that you're not, if you don't want to return money, if you look at your other contracts in place with other organizations, can you expand that money? Can you increase the money for those to do a little bit more on each one of those? And then you're not returning the money. And that's a Marcy question, I think, because I'm not sure about the timelines, on contracts and things like that.
Yeah, that would be a conversation we would have with the rest of staff. I would have with the rest of staff to figure that out. There's 3 contracts already in place that the council approved in June. That is self-advocacy, Arizona Achieve by the ARC. The ARC is also doing another 3rd year of support decision-making training. And then NAU's project for the OPS program, which is the training on how to protect kids from being victims as they use social media and their phones and different apps, and not to be victimized and so forth. So that's a 2nd year. And then everything else that is on this agenda is all new funding. And if there was a program or a project you potentially would consider voting for and you thought that could use more money, that is something we could go back and update the budget for and their narrative and see how they would go ahead and use the funds, or either go back to the 3 existing to see if they could potentially, I think none of them would say no, Kathy, to be quite honest, but they would have to resubmit a couple of forms, a couple of things back to us, for the existing. And the new ones we would have to rework a little, some things too.
Okay. So then one last question. If we decide that we don't want to move forward on year 2 on this, could we think about doing it next year, of giving you time to modify the requirements and let them resubmit? I don't know. Just if we don't want to lose all of this work,
Yeah, it's really difficult to say. It's difficult to say at this point about doing something next year because the next fiscal year, of course, is the first one of our new 5-year plan. And we don't know what the goal areas are going to be. We might make some assumptions that this kind of work will fit in with whatever we decide upon, but we can't say that definitively at this point.
Okay. Thank you.
Okay. Lonnie, go right ahead.
Yeah, that was part of the challenge with reading this proposal, is that they kind of implied that there would be future funding. And as John just mentioned, part of the challenge is we don't know if this work is carrying forward into the next 5-year state plan. And with the concerns of the outputs from the first year and kind of what we saw as being lack of output from the second year proposal, assuming that there's going to be additional funding moving forward to try and get this. And again, we've been working on this since 2018, and where has the needle moved is the question. It's like, it's a huge issue. It's one that we should focus on, but how do we find something that we can move the needle on and focus on that? It's like, how do we create an outcome in this space? Because despite our best efforts, we don't seem to be getting there. And so I think that's why we're looking for feedback from you. It's just like, we're trying to move the needle. We've tried several competitive solicitations in this place. And, you know, at the end of the 5-year state plan, what do we have to show for it? And, you know, do we carry forward if we haven't had success? But then who else is going to take up the charge in this space if we don't? So it's a whole, it's very complex, and we don't know. Help, please.
How do you feel about reverting funds?
I don't know. Not great about it, because we haven't done it before. But, you know, is it better to revert funds, or do we say that this proposal has enough going for it that, I mean, they could make some inroads. They could do some good, maybe not what we want it to be, but not doing anything, we know for sure isn't going to have an outcome. Is it better to have a less than ideal outcome and not revert the money, or revert the money and, you know, I mean, if we throw money at other projects, are they going to be able to ramp up in a way that they're going to have better outcomes? So I don't know that redistributing will make better outcomes for what's existing either, if that makes sense.
Yeah, it does.
I'm not so sure we know.
Yeah.
Where
So, and
we
again,
want to be. Do we want to? We haven't even, as a council, decided what do we want to do as far as we want better education out there. We want more people to know. But what percentage? Do we know a percentage? Like, do we want to increase 5%? People understanding it, 25%? Maybe we need to sit down and talk about that a little bit more, about what do we want to see, you know, before we put it out for a contract. I don't have a problem with reverting. I think this year has been just a weird year, you know.
yeah, we were very much backed into a corner, and it is hard to operate under, you know, the parameters that we've been given.
Yeah. But I also think, could we move that money to another contract and not lose it? I don't know.
Okay. Jana, would you like to share your thoughts? Because you did post something, but would you like to speak up there? Thank you.
Sure. Yeah, I was just thinking about this is really important work. And I think we all can agree that while we didn't get what we were looking for, because we really were wanting something that was more of a systemic kind of policy change focus, but just to Kathy's point, just to lose all of the good work that's been done up to this point. I mean, I understand we didn't get everything we were looking for, but like we all said, who else is doing it? Who else is going to do it and pick it up? I'm afraid if we revert the funds to another project, then who's going to be working on sexual violence for people with IDD? And gosh, you guys, should we let this go? I say, I mean, I would support a no vote with, you know, going back and giving the USET a little more time to resubmit with a more robust policy change focus. And I think that was something that Marcy alluded to earlier in her explanation. Because I would just be really, really worried just to no vote and reallocate the dollars somewhere else. And then who's talking about this in our community? That's my worry.
Okay, that's a good point. Go ahead, JJ.
So real quick, I know we're running long, but I thought I had heard Marcy saying that was not a preference or fair to JC to go back and say, and maybe this isn't what you're suggesting, Jana, is to like either amend or update. If you're saying something different, I apologize. But I totally agree the value or in work in this, and this has been something that I think also the council, I would speak for myself. I've always prided myself in being part of the council and the work they do in this space, and maybe that's also why we're sensitive to this really not moving the needle, because I think the council has moved the needle. I would support it with if there were anything we've done in the past to kind of provide technical assistance support for a grant. You know, I recall some folks struggle with some other grantees struggling, and the council provided either some support, monitoring, or otherwise. That way, then we can kind of have more, if there is a way to have more check-ins or require more check-ins, maybe that can be quickly added. So we have progress reports to make sure they're moving the needle in the direction of and achieving the goals that we want. I mean, I think I remember that, or I remember a couple of grantees, we were at least talking about ways to support them or check in to make sure they were doing what they said they were doing. So if we could put a motion on the table, if that's possible, that says we support with this added or something like that, that might be the best result so that we can ensure that we're getting at least some of what we're hoping for from this contract and not revert funds. But I also think it's a weird year and that could be easily explained, and, you know, but I'm leaning towards Jana. You kind of convinced me that, you know, there isn't anyone else kind of doing this right now, and it's always been the council, so don't want to lose that. So hopefully that made sense. If there is a way to provide TA or check-ins, I would support it. That way we could ensure that the council is getting what they're paying for.
And I would be comfortable with that. Like, if we weren't worried about the money, I would say no on the whole thing. If we had other people that we could go to that would do the work, but I don't see that right now. So I'm in agreement with you, JJ, and with Jana. Yes, John.
Yeah, and just as an FYI, we had this conversation amongst Lonnie and Marcy and myself a couple of days ago. There is literally no one else in Arizona supporting work in this area around people with disabilities. So the council is the only funder for projects going on in this area. And it's part of my reason for saying that I don't want to see us step back from it necessarily. I just want to make sure we're getting what we're paying for. And if I can speak for Marcy, I think, oh God, now I've lost my thought. Never mind.
Go ahead.
Yeah, so, you know, it was about asking JC to do more clarifications. I think what Marcy was saying is it's not fair to JC because we're funding so many projects with the Sonoran Center, and we asked them for so many clarifications already to prepare for this meeting that we really overloaded her. Now, if we can move forward with the understanding that we're going to need to make some modifications to the proposal and to the contract, and that, you know, there will be an expectation for more frequent check-ins, and there will be an expectation that some of the elements here may be minimized and others may be expanded, then I certainly would feel more comfortable with us supporting this. And I think that we, between Lonnie and Marcy and myself, we can help craft whatever changes need to be made. I don't think it's realistic for us to expect that they can be in place for next week's council meeting. That's the only thing. I'm fully in support of us continuing to fund this project in this area if we can create it or craft it in such a way that it makes us happy. We all need to recognize that there's limited time to make that happen between now and the council meeting, so we might need a little more time to take that on.
Okay, go ahead, Jana.
I'm sorry, I forgot to raise my hand.
That's all right.
Out there. I'm so sorry. That's really what I was suggesting. I do 100% appreciate, you know, not being able to flip this back to JC and be like, can you do this in 2 days? You know, yeah, I understand the the that burdensome ask. So that's more what I was getting at.
Okay. So if I make a motion to approve with what we're asking, I'm trying to figure out how to word that with what JJ asked and Jana asked. And what I'm hearing is that we really all want more oversight with this, more check-ins, maybe some more technical support with them. JJ, did you have a suggestion?
I think John said it nicely. Would be a motion to approve, subject to either some additions. I forgot how you said it, John. That gives us latitude to still think about also how to think about it and then circle back to JC. So it was a motion to approve contingent upon some, I don't want to say edits, I mean maybe some modifications as outlined by we could say the executive committee and or the full council. Does that sound like a motion that allows us some of that room that we just talked about?
Well, are we guiding them? Is that what we're trying to do, or give them more information on really what we are seeking, too?
Yeah, I think it's the latter of
Yeah.
those two options.
Okay. John, did
So-
you have verbiage? So, oh, sorry, JJ, you were still talking.
No. If we could cobble that together, whoever's taking minutes, if that makes sense. So motion to approve, subject to. I like Kathy's last either or option on the second part, Kathy. Anybody writing that down? I'm a better speaker than I am a writer.
I've heard a couple.
Guys, this is Kelly Roberts. I have to jump off the call, but I'm open to approving with the conditions put forth. I
So
just
moved.
wanted to not impact quorum. Sorry, so I have to get off the call.
So I think Kelly made a very clean motion there. So I will second Kelly's motion. Hopefully somebody caught that.
Okay. Do I need to call for a full motion with the amount in there?
I need the full statement. There's
Yeah.
been too much little jumps here and there. So if we
Yeah.
can get a full motion stated, because it's being recorded and I'm the one that's
Yes.
kind of typing these up.
Yes, that's why I'm like, I've got to do the whole thing. So I'm asking for a motion to approve contingent upon, and the rest of the verbiage is what I'm looking for, because I've heard two different ways to word that. John, did you have thoughts on that?
Oh, I'm probably not adding anything valuable, just contingent upon the modifications made to the proposal as guided or as directed by the executive committee in order to achieve the outcomes the council is most interested in achieving, or something like that.
Oh my goodness. So much. Sorry, guys.
Yeah.
And this is when the state requirements come back where you actually are recording things. But I would say what John just said, but.
Well, we are recording this, so we can always refer back to the recording.
Okay, so how about this?
Marcy, I'll help you with that.
Thank you.
Okay, I'm going to try this. So I'm going to call for a motion to approve the collaborative approach to better respond to sexual violence year 2, University of Arizona Sonoran Center, and the amount of $72,414. Approval contingent upon modifications made to the proposal is guided by executive committee to achieve outcomes the council is seeking. Do I have a motion?
So moved.
Thank you, JJ. Do I have a second?
I second. This is Kathy.
Thank you, Kathy. All those in favor, please say aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion carries, such as it is.
Can I, JJ, before you ask
Sure,
a
go ahead.
question, can I
Go
just ask just a quick clarification? We are going to go back and ask JC, some additional clarifications. And obviously, I think it's really important, as someone mentioned, additional oversight, additional TA. Absolutely, we'll continue to do that as part of that. And probably more frequent calls would be necessary to ensure. But are we bringing a revised proposal back to the executive committee at a future meeting, not November's meeting, but a future meeting, so that you see what has been changed? Do you want a full proposal revised back in front of you guys, or you just want us to seek that and move it ahead?
You're muted, Melissa.
Thank God it's Friday. I'm comfortable with you guys seeking the information and moving it ahead because we're all on the same page here. It's really clear. We've had a very robust discussion on it. Are there other committee members that want to see something before it goes forward? Or are you comfortable with staff moving forward with this?
I kind of agree with what's being said.
Okay. Does anybody need to see it for it to come back for discussion? Or are you okay with staff moving forward with this? And they can keep us updated.
I mean, we could certainly send it to you without another meeting for a vote, and you guys will have it. So I think it's only fair to give it to you once we have it. But we don't. What I'm asking is, we don't need to come back as a committee to review it and vote.
Right, I agree. I just
Okay.
send us a copy.
Send you a copy.
Yes.
Okay, we'll do that. I'll make sure we will do that.
Yeah.
Thank you.
All right. Thank you. So we can move on to our next section. And we are running long, guys. Apologize, but we've got to get this done before our council meeting.
I know JJ had a question.
I had a comment and I apologize, but
Okay.
if we need quorum, I have my board meeting starting in 10 minutes. So I better go and entertain my bosses. But if you need me, let me know. I can stay on the phone and then just for I know we have some other action items, I believe. But do we still have quorum if I'm doing a count?
As long as no one else drops off, we still have 5 members of the committee, so we still have quorum.
So Kelly dropped off.
5.
Right. But we
Yeah.
still have Kathy, Melissa, Monica, Jenna, and Vijay.
Yeah.
Okay.
We'll have 5.
Text me if somebody jumps off and I'll step out and cast a vote if I need.
Okay.
So sorry about that, everyone. Have a good one.
It's okay. Thank you
very
JJ.
much, JJ.
Thank you,
Thank
JJ.
you.
Thank
you.
you so much.
No problem.
Okay, thank you, everyone. Oh my God, thank you. We really needed this discussion. This was helpful. Okay, I'm gonna move on to,
Oh, boy. Just a note, Jana has a meeting at 11 o'clock.
Okay. Are we losing quorum?
If Jana leaves,
I can stay on till 11. I can try to push and be a little bit late. So just want to give you guys a heads up.
we have 5 right now. And so we need 4 for quorum, so we can keep going.
Okay,
If I'm wrong, let me know.
okay.
Okay.
John, are we okay with 4 after we lose Jana?
Yeah, we
one,
have 7 members of the committee, so 4 is quorum.
Okay. All right, I'm going to be brief again on my last 2, and then Michael has to cover his. So thank you for entertaining us on this NAU's proposal. So Kelly's gone, so we're good at this one. It's called AT Bridge, and Bridge is Building Readiness, Inclusion, and Direction for Goals in Education at 50,000. And this falls under the inclusion goal. This is kind of the next phase after we funded the Atlas program, which was assistive technology for college-age students with IDD beginning to go through community or at NAU that needed an assessment on what their their assistive technology needs are and how to support them through administrative and support. Well, I don't want to use support coordinators, but additional staff support that would be there so that they could use the best AT for them that would get them through their college experience. What this will do is bring it down to the high school level. And what they're proposing is they're going to partner with 2 to 4 high schools in Coconino and Yavapai County, including outreach to tribal schools. They didn't identify the schools, just so that you know. But they want to target a minimum of 8 students with IDD that are either in 11th or 12th grades. So obviously we want to make sure you're just not focused on Flagstaff and Coconino County, do some further outreach to other areas. And they said, absolutely. The schools are going to identify the students in grades 11 and 12 who would benefit from assistive technology to support their academic and transition goals. Each student, this is very spelled out nicely in their proposal, will receive individualized AT consultation, personalized training, and ongoing coaching designed to support their academic success, independence, and achievement. For success of this program, they're going to do 2 things. They want to ensure that They collaborate closely with special education teachers and school staff to ensure they are supporting the students and the goals of this program. The other positive thing is they are inviting 3 students who successfully completed the Atlas program to be AT ambassadors or peer mentors, which is really helpful so that they can share their own experience that will foster engagement, promote inclusion, encouragement, and confidence. So that is a nice little touch with that. And then in terms of evaluation, they have a really, really robust evaluation to measure AT usage patterns, academic participation indicators through self-reports, interviews they will be conducting. They will be tracking progress on IEP goals. And then other data points include student reported confidence levels, family and school feedback, and then school readiness to sustain assistive technology practices after grant funding ends. And then the other thing, as a last thing that they will develop for this as part of this grant, is to develop a replication that could be used statewide. So they're going to develop recommendations on how this can be sustained and then how other schools can implement this. And that includes a written summary of lessons learned, examples of best practices, and the development of a toolkit that other schools can use if they wanted to implement this type of model. Questions?
No, I read through it and I'm kind of excited about it. Okay. If there are no questions or comments, I'm going to call for a motion to approve a new contract, Assistive Technology Building Readiness, Inclusion, and Direction for Goals in Education at Bridge by Northern Arizona University Institute for Human Development in the amount of $50,000. Do I have a motion to approve?
This is Vijette, so moved.
Thank you, Vijette. Do I have a second?
This is Kathy, so move.
Thank you, Kathy. All those in favor of approval, please say aye.
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 All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion approved.
Okay, thank you. Okay, this will be quick too. This is another Sonoran program regarding support decision-making for physicians and healthcare system leaders. This was submitted by Dr. Bassford, Tammy Bassford. And what is she proposing is to expand support decision-making, knowledge, and how it could be used and within the healthcare systems. She has a number of things, of steps that she's going to do. So I'll just get to it on the bottom of the first page of my summary in the second. The paragraph before that is really important to highlight. If you take the time to read that, I quoted what she quoted in the application. Practicing physicians and other healthcare providers are not well educated and trained about legal issues surrounding transition of children with IDD in adulthood. They have not been trained to discuss support decision-making with their parents or to utilize an agreement when presented with it. Furthermore, physicians and other healthcare providers face systemic barriers, including lack of policies and guidelines by the organizations about SDM, how it relates to existing policies on consent or HIPAA, or where to store any SDM agreements. So this project is meant to assist this problem. So what they're going to do in 5 steps is they're going to do a physician survey, SDM physician survey of Arizona. So physicians and health organization leaders understand what is their knowledge, attitudes, and behaviors in the policy workflow barriers. She's going to conduct 3 interviews and 1 interview with practicing physicians from Banner in Tucson, a 2nd interview from a federally qualified health center in Tucson, and then 3rd interview will be conducted either with a chief medical officer or director of nursing from Banner, Tucson. So first thing is to do is this big survey. Second, she is going to develop a report based on that feedback and the data collected from surveys and interviews to identify the gaps in knowledge, attitudes, and behaviors of practicing physicians, as well as the barriers to SDM implementation. So the recommendation and the report itself will be submitted to the council. Based on that report, she's going to create on the 3rd bullet point, PowerPoint on SDM for physicians as a pilot testing. It will be evidence-based, annotated PowerPoint slide set on SDM and regarding the bill that passed 1291 to make this law. The ARC of Arizona is going to partner with them, which is really nice because Melanie has done a lot of work on this phase of the project. Dr. Bassford will update the PowerPoint based on feedback she receives from the 15 practicing family physicians and family medicine residents who she's going to pilot test this. And she will record the feedback received from the systems barrier, and then we will receive a copy of her presentation as well. The last 5 months of this contract in their timeline, she's going to conduct 15 in-person or online presentations to physicians on SDM. She's going to conduct outreach to various departments and family medicines that she's affiliated with or that she knows. And then survey data will be collected from each participant after each training to inform her how well this is being received and any changes and recommendations that they need to do going forward. In the final month, she is going to develop a proposed work plan to address the system barriers to SDM identified in this report, feedback from the survey responses from each training, and from informal conversations that she will have with physicians, probably during the training of the presentations. And then potentially the work plan could lead to additional support by the council for consideration if that is needed. That's in a nutshell what she plans on doing. It's a pretty ambitious timeline.
Go ahead, John.
Thanks, Melissa. I just wanted to tag on to that and say, first of all, the two areas in which supported decision-making is facing the greatest barriers, the greatest challenges for acceptance are financial services and healthcare. And so we think this is, I personally think this is an incredibly important project. I recognize that it is relatively small scale at this point, but it is essentially a pilot. And Dr. Bassford, if you know Dr. Bassford, you I think would agree with me that she is a tremendously valuable resource to the IDD community. She understands the IDD community. Many of her patients have intellectual or developmental disability, and she is really passionate about supported decision-making and its role in the healthcare environment. So I feel very confident that this project will be successful and that she will help to kind of blaze a trail for us to do much further work in the healthcare environment, and that is absolutely essential for supported decision making to realize its potential among our community. Thank you.
Thank you, John. I 100% agree with you. I did take the time to read through it, and Jana is 100% in agreement. Are there any more comments or questions before I call for a vote? Okay, hearing none, I'm going to call for a motion to approve supported decision-making education for the healthcare system, University of Arizona Sonoran Center, in the amount of $35,000. Do I have a motion to approve?
This is Vijat, so moved.
Thank you, Vijat. Do I have a second?
This is Monica. I'll second it.
Thank you, Monica. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion passes. Next.
That's Michael's turn. Thank you, everybody.
Thank you, Marcy.
Thank you, Marcy. Great work. This is a proposal that was submitted by the Sonoran Center for Excellence in Disabilities. The name of the project is Conducting a Statewide Needs Assessment and Environmental Scan to Promote a Sustainable DD Navigator. The amount that is requested is $35,000, and it aligns with goal number 5, system access and navigation. The goal of this project is to conduct a needs assessment and environmental scan to understand the potential professional scope, context, responsibilities, and sustainability of DD navigators, to act as liaison and advocate for refugees with disabilities. Approximately 20% of refugees have disabilities. Previous research indicates that they are not connected to the services they are eligible to receive in the state of Arizona. Both individual and systems level barriers influence refugee access to disability services and supports, including lack of clarity about disability services, inability to get the support needed to pursue education and employment, and lack of linguistically appropriate services. The Sonoran Center proposes to work closely with stakeholders, such as the International Rescue Committee, throughout Arizona to conduct an environmental scan and needs assessment to inform the implementation and sustainability of refugee DD navigators. Since refugee resettlement has been halted by the federal government as of January 2025. The environmental scan will enable the Sonoran Center to understand the current landscape of social services for refugees with disabilities and help collaborators plan. Statewide, the Sonoran Center will evaluate needs related to disability information for refugees and existing infrastructure among organizations. For example, councils on aging, federally qualified health centers that serve refugees. Project activities include the following. 1, conduct a review of national and state policies that would support a DD navigator. 2, identify existing community health worker trainings related to disability. 3, identify organizations statewide who employ community health workers who might interact with refugees with disabilities. For example, federally qualified health centers, councils on aging. 4, conduct a statewide needs assessment related to DD navigation feasibility, acceptability, and sustainability. Project activities will result in the following 3 deliverables. 1, a policy brief. 2, resource guide for disability training courses for community health workers. 3, report on the findings from needs assessment. Deliverables will be disseminated on the ADDPC and Sonoran Center websites through investigator networks and in peer reviewed journals. For example, policy and health journals. The current federal administration has limited refugee resettlement and will implement new eligibility requirements for public programs. For example, Medicaid, Supplemental Nutritional Assistance Program, that will limit access to services for refugees who have been resettled and who are not yet legal permanent residents or are not citizens of the United States. The environmental scan and needs assessment will help the team identify potential connections, collaborations, and creative responses to a gap in federal funding, and build the evidence base for implementation of refugee DD navigators locally or at the state level. In the long term, the DD navigator model may help buffer the loss of access to certain federal programs for refugees, while also building capacity and connections for when those programs become available to refugees again. I also want to add that this is building on the work that was performed by the Sonoran Center, elevating the refugee perspectives about access to disability services. And in that work that they did, that they performed rather, one of the most important items that they identified in their community listening sessions and their group cluster mapping is to identify gatekeepers who can provide and help refugees with disabilities. And so this proposal that was received builds on that work. I just also want to add that they have a really good team in place. The principal investigator is Dr. Julie Arman. The co-principal investigator is J.C. Farkas. And then they have 4 other individuals who have broad experience serving the disability community. I'm sorry, the refugee disability community. Are there any questions?
No, not hearing any. Read through this one too. Read through all of them, actually. I'll just say that. I'm like, again, another one. Important work needs to be done here for all the obvious reasons you stated. So if there are no comments or questions, I'm going to call for a motion to approve the statewide needs assessment Refugees with Disabilities project from the University of Arizona Sonoran Center in the amount of $35,000. Do I have a motion to approve?
This is Vijat, so moved.
Thank you, Vijat. Do I have a second?
I second it. This is Kathy.
Thank you. Thank you, Kathy. All those in favor of approval, please say aye. Aye.
Aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion passes. Thank you, Michael. All right, number 4, our last one.
Thank you, Melissa. This is another proposal that was submitted by the Sonoran Center for Excellence in Disabilities. The name of the project is DESP Impact Initiative. The amount that is requested is $35,000, and it aligns with goal number 2, which is meaningful careers. And of course, I'm biased about that goal, but the Sonoran Center for Excellence is requesting, again, $35,000 from the council to implement key recommendations from the 2024 Direct Employment Services Professionals Survey. This effort, the Arizona DESP Impact Initiative, builds on a strong data-driven foundation developed in collaboration with ADDPC, the Arizona Association of People Supporting Employment First, our Arizona APSE chapter, and the Colorado Office of Employment First. And when I refer to DESP, Direct Employment Service Provider, I'm really talking about job coaches, job developers, those individuals on the ground working directly with people with disabilities and to help them obtain employment. This proposal offers a detailed and actionable plan to support the professional development of DESPs, again, job coaches, job developers, fill identified training gaps, strengthen the service system through ongoing structured collection and other meaningful support for disability employment professionals, provider organizations, and the systems that support them. All activities will be grounded in best practices and developed through ongoing stakeholder collaboration. Each objective includes a real-time feedback loop to ensure emerging deliverables meet community needs. In 2024, advocates and stakeholders in Arizona Disability Employment Services came together to design, implement, and analyze the results of the Direct Employment Services Professional Survey. The DESP survey results yielded 242 valid responses. The DESP survey indicated that only 40% of caseloads resulted in CIE placements or competitive integrated employment, which indicates an overwhelming need for professional development within the sector and strategic investment in cross-system collaboration and understanding. The Sonoran Center has developed the Arizona DESP Impact Initiative project proposal focused on strategic objectives to increase the needs of the disability employment services system in Arizona. They have 3 objectives. The first objective in their proposal is a certification support fund pilot. So the DESP survey findings indicate that disability employment professionals want quality training and cost is a barrier. This objective will create a certification support fund pilot to gauge interest and follow through with certified employment support professional training, which is CESP, and credentialing through National APSE. The Sonoran Center will partner with Arizona APSE to support a small group of Arizona employment professionals in pursuing the CESP credential. This pilot will test whether organizations are willing to support certification and funding is available and will explore what types of assistance DESPs may need during the certification process. Arizona APSE will either provide technical assistance or serve as an implementation vendor. Outcomes will include developing and testing an application process, developing transparent vetting criteria to determine who will receive funding, launching the application statewide, developing marketing and outreach materials, and ensuring equity and representation across providers, including provider type, area served, population specialties, and cultural diversity. The fund will be developed to reimburse application and exam fees totaling $199 per qualified and selected applicant, with the goal to support 5 to 10 professionals with this process. The second objective is to develop and launch on-demand foundational trainings for DESPs. The DESP survey highlighted the need for additional training opportunities for professionals. While objective 1 is intended to increase across to increase access to certified credential opportunities, a generalized training gap will still exist. Within this project, the Sonoran Center will develop additional resources for the training and education of disability employment professionals in Arizona. The Sonoran Center will develop and pilot 3 on-demand onboarding trainings to support new and emerging employment professionals in Arizona. These training modules will focus on the 3 most requested topics identified by Arizona DESPs. 1, system navigation, 2, disability employment policies, and 3, providing culturally responsive employment services. These modules will include self-paced videos and links to resources. Trainings will be accessible for all learners using universal design principles. Each training module will be user tested by 5 to 10 disability employment service professionals, with feedback incorporated into the modules before they are released to the public. Project partners will provide technical assistance in the development and evaluation of the modules. The Sonoran Center will seek technical assistance from the Colorado Office of Employment First, Arizona ADDPC, and ADDPC in developing the modules. The Sonoran Center will host and facilitate regular engagement activities with all collaborators on this project. Arizona ADDPC, ADDPC, and again, the Colorado Office of Employment First, and other key stakeholders as identified. These activities will consist of scheduled virtual meetings, email communications, formal feedback requests, and shared documents. This facilitation will provide an opportunity to give feedback in real time about the rollout of the certification fund, the training being developed and tested, and overall systems navigation barriers and successes encountered through this work. The group this group will explicitly identify barriers and resources related to navigating systems in Arizona and make recommendations to improve, address, and develop supportive resources. The Arizona DESP Impact Initiative project is designed to both explore and test remediation strategies for all gaps and areas of need that were illuminated by the survey project. The process will lead to stronger and more practical solutions with recommendations and strategies to sustain and scale interventions. Every step in this process will be documented from meeting minutes, requests for feedback, pivoted strategies to overcome barriers, and formal material development. The processes, summaries, and documentation will be aggregated into a final summary report to be submitted to the council, and that can be shared with council members, funders, or other interested parties. Additionally, a summary slide deck will be submitted to aid partners in sharing the success of the project. Lastly, the project aligns with ADDPC's goal to increase the potential of people with disabilities and link them with identified resources that are needed for them to achieve their career and employment goals. This project will fund efforts to formalize collaborative engagement across stakeholders, invest in developing needed infrastructure, and provide opportunities to engage potential employers while ensuring that systemic barriers are addressed. Outcomes are designed to be foundation-level investments that can be sustained and scaled to meet the unique, diverse talents of disabled job seekers across the state. The efforts of the Arizona DESP Impact Initiative will strengthen Arizona's disability employment system, expand professional development opportunities, and lay the groundwork for sustainable, scalable improvements that advance competitive integrated employment. The Meaningful Careers Committee met and reviewed the proposal that was submitted and asked for some clarifying questions, and the questions related to the capacity. Does Arizona ADDPC have the capacity to do everything that is required of them? Who's going to provide oversight for completion of the projects to make sure they're done in a timely basis? How are they going to be able to document whether the individuals that obtain a CESP certification did that actually lead to increases in competitive integrated employment? That overall was the most important issue or question that was raised. And unfortunately, there is no evidence, no data, no research at the moment that that confirms that if you have a credential, is it going to lead to increased outcomes? However, I strongly believe that if the DESP individuals, those serving people with disabilities, are held accountable, if there's more professionalism in the industry, if they are receiving more education, more resources, more tools to help them do their work, inevitably those increases in employment are going to start to appear. I really appreciate the fact that Melissa had some questions about this. Melissa contacted Jane Windsor, who was a preeminent investigator in employment. Gene Windsor is a person that was the primary investigator for the Power of Disability Employment, as well as a vocational rehabilitation study. And so Gene quickly responded to Melissa and sort of confirmed what I said, that there is no research. However, if this project is able to move forward, we might be able to do some original research here in the state that leads to this conclusion. So, Melissa, I don't know if you want to add to that, or if anyone has any questions. And I apologize for going through this so quickly, but
No,
I'm
it's
available
okay.
to answer any questions.
Thanks, Mike. No, I'll say, Jean did send me a lot of information, a lot of links, a lot of different things. And if anybody wants that information, I'm happy to share that with them. And that was shared with Mike and with John as well. And I said, please share it with staff if they're interested. There is no big research on this. In fact, one of the PowerPoints Jean sent was actually a conference presentation I had sat through at the last APC conference, and specifically on certification and other things. And it is kind of mixed, right? But this is what I do for a living, and I have my own thoughts on certification. But what I do know, first from the conferences, the 3 areas that this grant, that the additional trainings that they want to develop around, those types of sessions are really heavily attended. People are seeking information in those areas. So I feel like offering support and technical assistance and training in those areas here in our own state, there's a need for that. I really support that. I think it will also show how much of an interest there is in becoming certified. And I would love to see this be a foundation for further research, because there really is none. But you can't just get the certification and then know immediately. You have to look at that, you know, putting a person in a job and compare people with certifications versus job coaches that don't have certifications. And that's a big reason why the research hasn't been done. So it's going to mean comparing, you know, 2 different things and outcomes 3 months, 6 months, 9 months, 12 months later. And it would be pretty exciting to have a basis to do that in Arizona, because nobody has done that. It's important. So that being said, I am supportive of this. I got my questions answered. I feel very reassured with all the clarifications regarding APC. And I know some of the staff down at in Tucson that's going to be supporting them and staying on top of them. And I am comfortable with that. So are there any questions or comments before we make a motion on this? Yes, Kathy.
I just want to make a comment to get it on record, is that the Maternal Child Health MCH at the federal level has a website where they encourage the state's MCH programs to use evidence-based practices and strategies. And they have a toolkit to help states develop those evidence-based strategies. I think at some point maybe we should look at that, because I agree with you, Melissa. I think we should be the ones that establish this, if it turns out well, as an evidence-based strategy for states and other programs to use. So I'm just trying to plug that I think we should be thinking forward where we might want to take this project, as far as something we might share with other states, that we prove that it's evidence-based or evidence-informed. So,
I like that. And what is the name of that website? Maternal?
It's the Maternal Child Health MCH I call it the evidence-based tools. I'll send it to you. How about that?
Okay. Okay. Thank you. That would be great. And please send it to Mike and staff too. So that would be fantastic. Okay. Thank you very much. I appreciate that.
Thank you.
There is. Okay. Any other comments or questions? Okay. Hearing none, I'm going to call for a motion to approve Direct Employment Support Professionals, DESP, Impact Initiative by the University of Arizona Sonoran Center in the amount of $35,000. Do I have a motion to approve?
This is Vijay. I approve.
Thank you, Vijay. Do I have a second?
I second. This is Kathy.
Thank you, Kathy. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone not voting? Okay, thank you. Motion passes. Thank you so much. Okay, fantastic. We're going to move on very quickly to our full council meeting agenda. That will be a long one. If you want to go through that, it's going to look pretty similar to what we did today, with the exception of what? Maybe some committee report outs, right? Yep, that all
is
looks
correct.
That's
Yes.
the only thing. Thank you, Kathy. I will click on that before our meeting is over. Yep, the only really different thing to this one is our committee work group report outs, which we have at all of our meetings. Okay. Yes, Marcy.
Quickly, are we taking out the Sonoran USO proposal? Because we're still going to be engaging with JC.
Oh my gosh. What do you need to do to get it done with the motion that was made?
Well, your motion gives us the approval to engage with JC and make changes. And then we'll send a copy to you guys. So you're kind of formally approving it as long as we are satisfied with what she responds to with additional information.
Yes. So
Would you feel, sorry,
ahead.
Melissa, would you
Nope.
feel more comfortable if the council as a whole took action on that as well? Or do you want to just have the executive committee act on behalf of the council?
I think the full council should get a say, personally. I know it might complicate things. Kathy, you were nodding your head. Where are you at with that?
Boy, that's a good one. I think does it slow you down with the whole count? Okay, so ask the question again. Are you wanting to know if we should have full council approval or just let her go? We're not sure what the question is now.
Well, my question is, do we want the executive, on this particular point, this particular contract, do we want the executive committee to act on behalf of the council, giving us approval to move forward with JC and get the modifications made that we think are appropriate? Or do we want to present this to the council and allow the full council to have conversation about the matter and weigh in on what we're proposing to do?
Well, that slows us down even more. Wow.
It does. And I suspect that we're going to kind of have the same mix of I hate to cut anything out of the loop because we've always been about transparency, right?
Yeah.
So I'm kind of stuck on that.
Yeah, I am too. But then I think, well, we have a representative from each committee.
We do.
How about, as a suggestion, and apologies again for interrupting, how about as a suggestion, we mention that the executive committee has charged staff with moving ahead in working with JC to make modifications to the proposal, that we not present the full information that was presented today, but we just note that this is an ongoing contract and we will be making the changes that are necessary to achieve the council's desired outcomes.
And if it doesn't happen at the next council meeting, we will tell you we will tell you at the next council meeting what the changes were. But if we are not able to get there, then we'll tell you what we did with the contract. Does that make sense? Like, let's say you work with JC and you can't come to a good resolution, then we go back to the council and say, we couldn't work it out. Or we do come to a good resolution, but we tell the council, full council, what we ended up with. How about that?
I'm comfortable with that. And I'm sure staff will bring up that there is nobody else doing this work and the importance of the work and all of that.
Yeah.
And here's why we're willing to pursue this a little bit further. I'm okay with that, John. So this would not go. not go up for a vote at the full council, but council will be informed about the status and what's going on.
Exactly.
Okay, I'm comfortable with that.
Thank you. I'm good
Okay.
with that.
You're welcome. Okay, so back to our
right.
meeting agenda for today, if we can, please, and I'll get you guys out of here. And thank you all so much for hanging in there. Okay. So we are we moving on? We looked at that. Okay, announcements. Item H, do we have any announcements? Okay. Agenda item I, call to the public. I do not note any public on this call. So agenda item J, we are adjourning at 11:30 a.m. Thank you so much for hanging in the extra hour, everybody. It was important. Have a good weekend.
Thank you.
Thank you all.
See you next week.
Bye. See you
Bye.
next
Bye.
week. Bye-bye.
Take care. Bye.
Bye.